Welcome to our podcast, where we uncover the most important and interesting stories for you. In this episode, we will discuss a study on deadly fungal infections which are spreading like a silent pandemic and can kill 40 million people in just 25 years. The antibiotic-resistant infections can kill nearly 40 million people by 2050, as per a new study published in The Lancet. According to the researchers, drug-resistant infections led to the death of more than 1 million people every year between 1900 and 2021. According to the report, this number can go up to nearly 2 million by 2050, which means that around 40 million people will apparently die in more than 25 years due to these infections. The researchers believe that the lives of a third of people can be saved if they get wider access to better treatment and appropriate antibiotics. Bacterial antimicrobial resistance takes place when the bacteria evolves and becomes drug-resistant, which makes common diseases like pneumonia, UTIs, and diarrhea lethal. This adaptation to exist beyond medicine is leading to a silent pandemic, which needs to be urgently addressed, stated the researchers. The threat of fungal pathogens and antifungal resistance, even though it is a growing global issue, is being left out of the debate, said Norman van Rijn, a molecular biologist from the University of Manchester in the UK. Researchers appeal govt and pharmaceutical firms to look beyond just bacteria. The international team of scientists and Van Rijn have appealed to the pharmaceutical industry and governments to look beyond just bacteria. They warn that if some action is not taken, the fungal infections can infect 6.5 million people and kill 3.8 million people annually. The disproportionate focus on bacteria is concerning because many drug resistance problems over the past decades were the result of invasive fungal diseases, which are largely under-recognized by the community and governments alike, wrote Van Rijn in the report. To treat deep or invasive fungal infections, only 4 systemic antifungal classes are available, and resistance is now the rule rather than the exception for those currently available classes, stated the authors. In the last few decades, new antifungals have emerged. However, the race between pathogens and medicine is now being sped up. Even before these drugs reach the market after years of development and clinical trials, fungicides with similar modes of action are developed by the agrochemical industry, resulting in cross-resistance for critical priority pathogens, explained the researchers. Antifungal protection is required for food security. The question is, how do we balance food security with the ability to treat current and future resistant fungal pathogens? They said. That's all from this podcast. Thanks for listening. We have many more such compelling episodes for you. Enjoy them. Do share your opinion in the comment box and subscribe to us for more.